Hello, everybody. This is Haidar Qasir talking to you. Today, we are going to talk about the OET test, the Occupational English Test, which is for healthcare, which is specialized for doctors. Uh, I just want you to pay attention to the parts of the OET. The OET test is divided into four parts, which is the listening, the reading, the writing, and the speaking. But it's totally different from the IELTS. Okay, let's start. Now, let's explain briefly about it. Listening. In the listening, the candidates are required to demonstrate that they can follow and understand a range of health-related spoken materials, such as patient consultations and lectures. Part A, consultation extracts, about 5 minutes each. Part A assesses candidates' ability to identify, specify specific information during a consultation. They are required to listen to two recorded health professional patient consultations and complete the health professionals' notes using the information they hear. This is for part A. Part B, short workplace extracts about 1 minute each. Part B assesses candidates' ability to identify the detail, gist, opinion, or purpose of short extracts from the healthcare workplace. They are required to listen to 6 recorded extracts, for example, team briefings, handovers or health, professional patient dialogues, and answer one multiple choice question for each extract. Part C, presentation extracts, about 5 minutes each. Part C assesses candidates' ability to follow a recorded presentation or interview on a range of accessible healthcare topics. They are required to listen to 2 different extracts and answer 6 multiple choice questions for each extract. This is for the listening. Please, everyone, if you have any questions, feel free to ask. Feel free to write your questions in the comments to answer them. Okay, now we go to the other parts. We have reading. Candidates are required to demonstrate that they can read and understand different types of text on health-related subjects. Part A, Expeditious reading task, 15 minutes. You need to answer around 20 questions. Part A assesses candidates' ability to locate specific information from 4 short texts to a quick and efficient manner. The 4 short texts relate to a single healthcare topic, and they must answer 20 questions in the allocated time period. The 20 questions consist of matching, sentence completion, and short answer questions. For parts B and C, careful reading tasks. It will take around 45 minutes. Part B assesses candidates' ability to identify the detail, just a main point of 6 short texts sourced from the healthcare workplace, 100 to 150 words each. The texts might consist of extracts from policy documents, hospital guidelines, manuals, or internal communications, such as emails or memos. For each text, there is one free option, multiple choice question. Part C assesses candidates' ability to identify detailed meaning and opinion in two texts on topics of interest to healthcare professionals, 800 words each. For each text, candidates must answer a four option multiple choice questions. Now we come to the writing. In the writing, it will be divided for each profession that you have. For example, as a dentist, as a radiologist, as let's say a vet, as also a chemist, which we also call a pharmacist, as a nurse, and so on. The task is to write a letter, usually a referral letter. Sometimes, especially for some professions, a different type of letter is required. For example, a letter of a transfer or discharge, or a letter to advise or inform a patient, carer, or group. Speaking. The speaking subtest is delivered individually, and the candidate takes part in two role plays. In each role play, the candidate takes his or her professional role. For example, as a nurse or as a chemist, while the interlocutor plays a patient, a client, or a patient's relative or carer. For veterinary science, the interlocutor is the owner or carer of the animal. Okay, I'm going to show you some examples here for the test. Here is, for example, the listening. The candidate number, you have listening subtest question paper, you have the name, the last name, and you have the middle names, also the profession, the venue, and test date. Then you have the instructions to candidates. Do not open this question, and so on. Parts A, B, and C here. Then here is part A. You have questions 1 to 24. You are going to listen and fill in the gaps here from 1 to 24. This is part A, the end of part A. Then in parts B and C. In part B, you have for questions 25 to 30 choices. Choose A, B, or C. Then you have part C, you have from 31 to 42 also choices. And you have, they will give you here 90 seconds to read. It's just like the IELTS, but this one is special for doctors, dentists, chemists, which we also call pharmacists, vets, I mean doctors of animals, and also for nurses, those who have a degree, at least bachelor in degree. This is for the listening part. Then you have the reading part here. In the reading, as we said, in part A, you will be given 15 minutes to answer 20 questions. Here, from 1 to 7, you have gaps. From 8 to 14, you have questions. Then you have from 15 to 20, you also have gaps with words from the text. Then, after that, you will have here, part B, choices for a text, which is beneath the point. Then In part C, here is the text, and here are questions also, choices from 17 to 14 about one text. Then you have a second text, and you will have also questions here. You have multiple choices. You need to choose the best answer for it. Here. Then you have the end of the reading test. Uh, here, here is a letter in which you are going to play the role of the doctor or the dentist or up to your profession. You have reading time 5 minutes, writing time 40 minutes. For example, you write to another doctor, you write a consultancy, sorry, or you write for a hospital about the patient. You have the patient history, the patient details, you have patient history, social background, medical history, pathology records. Uh, you also have here current medication. You have diagnostic consultation record, and you have the task, writing task. Using the information given in the case notes, write a letter to Dr. Trevor Lowe with your assessment and recommendations. Address your letter to DR, which means Dr. Trevor Lowe, Highlands Medical Center, 100 Home Road, Highlands. In your letter, expand the relevant notes into complete sentences. Do not use no form. Use letter format. It's just like the letter of the general IELTS when you write, but here it's for doctors. The body of the letter should be approximately 180 to 200 words. Do not forget, do not use note form at all. It's really important not to use a note form. Here, then you will have the speaking. In the speaking, you will play the role of your profession, and the interlocutor will play the role of, for example, the patient. You will be given time to read the task here, to read something here, the explanation, and after that, you will read the task, what they want you to say and to do. Then after that, you will be talking as, for example, a doctor or a dentist. Here, it's an easy test for doctors, dentists, chemists, which we call pharmacists too, and also for nurses who have a degree. I repeat, who have a degree, not those who have a diploma only, who have a degree as a nurse, who studied in the nursery school of blah, blah, blah university. Okay, now we come to the end of our free lecture to explain what you've got to do for the OET test.